Hello, in this video, I will tell you everything you need to know about DEPAKOTE, an antiepileptic medication. If the video is useful for you, don't forget to like the video and subscribe to the channel. DEPAKOTE is available in 250 mg and 500 mg tablets, and its active ingredient is divalproex sodium. What is DEPAKOTE and why is it used? DEPAKOTE works by restoring the balance of certain natural substances in the brain known as neurotransmitters. This medicine is especially effective when epilepsy, controlling seizures, bipolar disorder, treating manic episodes of bipolar disorder, migraine, preventing migraine headaches. What you should know before using DEPAKOTE. Before using DEPAKOTE, it's important to inform your doctor if you have any allergies. Specifically, if you are allergic to divalproex sodium, valproic acid, or valproate sodium, have a medical history of liver disease, pancreatitis, urea cycle disorders, Alpers-Huttenlocher syndrome, alcohol abuse, bleeding disorders, brain disease, kidney disease, dehydration, or malnutrition, you should share this information with your doctor. How to use DEPAKOTE? DEPAKOTE treatment, bipolar care, should be initiated and monitored in the supportive care of a specialist. Before starting and during the use of the medication, you must carefully follow your doctor's instructions. Here are some important points to know about using DEPAKOTE. Daily dosage and administration. For adults and the elderly, the initial dose is usually 750 mg on the first day, taken in 2 or 3 divided doses. The daily dose is then increased to 1000 to 2000 mg. Your doctor will adjust your dose based on your condition and response to the treatment. For patients with kidney problems, if you have kidney problems, your doctor may adjust your dose. For children and adolescents, DEPAKOTE should not be used to treat manic episodes in children and adolescents under 18 years old. How to take the medication. Swallow DEPAKOTE tablets whole with a glass of water. Do not crush or chew the tablets. Take the medication with food or after a meal. This will help reduce stomach discomfort and prevent possible nausea. Dosage changes and specialist consultation. If you think the effect of your medication is too weak or too strong, do not change the dose yourself. Instead, consult your specialist or family doctor. Precautions while using DEPAKOTE. Be cautious when using sharp objects to reduce the risk of cuts, bruises, or injuries. Avoid consuming alcohol and cannabis while using DEPAKOTE, as these substances can cause dizziness and drowsiness. For elderly adults, this medication may increase the risk of imbalance and falls, so caution is advised. Inform your doctor or dentist about all the medications you are taking before surgery. If you are pregnant or planning to become pregnant, you should consult your doctor about using DEPAKOTE. Divalproex sodium can harm an unborn baby during pregnancy, so it's important to discuss the risks and benefits of the medication with your doctor. Additionally, this medication can pass into breast milk, so if you are breastfeeding, you should consult your doctor before using it. Side effects and emergencies. Common side effects of DEPAKOTE include nausea, dizziness, drowsiness, weight gain, and hair loss. However, if serious side effects such as liver damage, pancreatitis, or suicidal thoughts occur, you should seek medical attention immediately. I have shared with you the essential information about DEPAKOTE in this video. If you have any questions or want to know more about the use of the medication, do not hesitate to consult your doctor. If you found this video helpful, don't forget to subscribe to my channel and like the video. Wishing you healthy days.